Bien. Et répétez la même chose. Bien. Et répétez la même chose. Bien. Et répétez la même chose. Kurt is going to show, he's going to roll first, and that's really an important component of rolling, is to get you to this position, supine and elbows. Once you get supine and elbows, then there's a couple strategies you can use to come to sitting from there. The first idea we're going to show is actually getting supine on elbows from this flat supine position. And one common way to do this is to utilize the roll first. So you would roll over, get prone on elbows, and then use a technique to come back and end up supine on elbows. So the first idea is, or the first challenge here is to roll. So if you'd roll over to your left. Good. And if you could actually get up and put weight on both your elbows. And this whole idea here takes a lot of work, takes a lot of strength that you can bear weight through both shoulders like this. And now what Kurt is going to do, he's going to bear all weight on his right shoulder and slowly bring his left arm around and touch down on his left shoulder. And if we could just repeat that again, I want you to really concentrate on his right glenohumeral joint. It really acts as a pivot point through all of this. Now slowly come around, touch down on the left. I want to repeat that again. And it's important when you learn these, when you work on these activities, to break up these activities in their fundamental components. If you have an hour-long therapy session, set certain goals for yourself and just key in on certain components of this. And this component right here is trying to use the right glenohumeral joint as the pivot point and rotating your whole trunk around it. Now come back to me. And you can certainly resist this or assist this depending on what needs the person has. Okay, so now we've accomplished the first important milestone to come to sitting is getting supine and elbows. He makes this look a lot easier than it really is when you first start. But first, you have to learn to rock side by side. And this requires loose glenohumeral joints and enough control to hang over one shoulder and unload one shoulder. Right? So now, if I let go of him, he can have all his weight just on his left upper extremity. And once you learn this, then the idea is to throw this arm back as far as you can. Notice the range of motion that this takes as well. Also in the biceps, because it's stretched across both elbow and shoulder. Now you've got to bring your body weight over the right shoulder and momentarily hang on that position and throw your left arm back and then walk up from there. And this activity requires a lot of range of motion in the shoulders. The second activity, the second way to come to sitting, if you can go back to supine and elbows for me, please, is a little bit different. This method, Kurt's going to kind of do a semi-roll over to his right, pivoting on his right elbow and touching down with his left elbow. And he's just going to kind of walk around in a semicircle. The disadvantage of this technique, sometimes it puts a lot of wear and tear on the elbows. And when Kurt gets to about this position, the next idea is he's either going to use his elbow flexors or wrist extensors on his left, and he's going to extend his right elbow by using these more proximal musculature. Remember, he does not have any triceps here doing this. This is an excellent example of using proximal musculature to extend this elbow joint as long as this distal segment is fixed. But if we just reverse that, if you don't mind, go back to about right here. So notice that he's actually attacking this bilaterally. He's using elbow flexors, right, to bring his trunk in this position because he's actually hooking his distal forearm against his relatively immobile right leg. But the key idea here is that he's able to extend this elbow. And he's really going to do it by strong contraction of his anterior deltoid and clavicular head pectoralis major. Why don't you kind of do that as slow motion as you can, but right here. Can you back that up just a little bit? Good. And come in again. Up. And this shows an excellent example here of the anterior deltoid controlling the flexion and extension of this joint. Eccentric activity flexes it, concentric activity anterior deltoid extends it. How about one more? And then come all the way up to sitting from there. Excellent. Kurt does not have triceps, so he has a difficult time elongating the overall length of his limb, but he still does that quite well by protracting the arm and leading with one elbow to try to increase this overall axial leverage that gives you the moment arm to help with a roll. He's also going to show how he's going to lead with his head and shows a lot of other different body mechanics that's going to facilitate this. Why don't you try that first? Notice how he's going to start with the center of mass is right near the sacrum. That's going to be the more area of inertia. Now, he's a little bit rusty on this, and we'll show a lot of good techniques trying to relearn this activity. Going to give you a little bit of help from about right here. Reach out, make that left arm as long as you can. Reach, and then back. All right, then come back to here again. Now reach out from this position. That's it. And then come back. Reach out again. And then back. Reach out again. Back. Let's try that again now. The idea is lead without left upper extremity. Get that as far to the left as you can. And the head leads, the trunk follows. That's it. Excellent. And then back. And it's very important on activities like this is to allow someone to get as far as they can into the activity and then kind of work backwards. You can get all the way to the roll and then you can work backwards from the roll. You come back here, now reach out and complete it all the way. Now come back a little bit more, now reach out and complete it. And notice this activity right here is this whole scapulo-thoracic protraction of the arm. Reaching out and leading with this left scapula elongates the thoracolumbar fascia here that helps pull on his pelvis because the point of inertia is right near the sacrum. Reach again. Relax. Let's try one more. Just start that again. Excellent.
empieza de nuevo, güey. Ok. Süvesken ist auch. Hier das Süvesken auch. Hier das Süvesken. Und schon alles. Hier das Süvesken. Hier da. Good.
Bob's going to show his techniques that he's learned over the years to transfer. Why don't you roll your chair up and kind of get set up to do a transfer for us. First angles the chair in, locks the brakes. Bob makes sure that his casters are rotated in such a way to increase the stability of the chair. And he's also worked his rear end forward to prepare for this pivot transfer. He uses saliva to increase the friction between his palm of his hand and the surface, and does a great sitting push-up to bring his rear end up and over. How about, if you don't mind, just coming back again? This really whole emphasis here is elongation of his upper extremity, and at the same time keeping his elbow locked. And using great head-hips relationship, bring his head down, bring his rear end up, and the balance and control that he shows during that activity. You want to try that again? And this time maybe you'll come all the way up over and then show us how you get your legs up on the bed as if you were preparing to actually go to bed and go to sleep. Notice the use of the wrist extensors on his left. Keeps his head low to unload his rear end. And the whole scapulothoracic depression is the key here. This activity right here. Just stop right there a second. I just want to emphasize the balance that you have in this point. Can you just kind of put your hands in your lap? Okay. Well, a lot of this balance is not only Bob's been able to actually control certain spasms in his trunk, but also his abdominal region yields some stability. He's got a low center of mass, and he's actually has just a great sense of balance. He also has a relatively tight low back that also gives him some kind of an anti-flexion torque to help control his stability. Great. Okay, now what if you were to bring your legs up on the mat? How would you actually do that? Bob has a lot of spasticity in his lower extremities, and he actually uses this to his advantage. He's now down on his left elbow. That's his central pivot. Excellent. Notice how he just pivots around his midsection. Please. we're going to show some important functional considerations of the serratus anterior. And the serratus anterior, if we recall, originates off the lateral part of ribs 2 through 8. And the muscle then goes on the anterior side of the scapula to attach to the whole medial border. So the muscle tends to have a line of pulse such as this. So the muscle is driven primarily by C6. So Angela functions at the C7 level. She has a really well-developed serratus anterior and doesn't demonstrate a lot of, really any winging. But to show how this muscle works, if you were to just kind of push straight to me, now make your arm short, push straight out. Now notice this functional elongation of this upper limb. This really is a protraction motion of the scapula. The scapula is protracting, pushing the glenoid, and therefore the whole arm forward. Now the reason why this is such an important motion, because this motion really is transferred really into this motion for a sitting push-up. It's just really the direction changes. And then when you're actually doing the sitting push-up, you also involve the lower trapezius. So this is an important functional motion, and this is often how you can individually test the serratus anterior activity. I want to show some activities that really can challenge this whole scapulothoracic protraction. This motion I'm showing right now is a nice way, because there's one way we can also do that where the person is actually prone on elbows. So if you wouldn't mind, if you could get prone on elbows for me. Now, as we said before, the serratus anterior muscle really is anchored to the whole medial border of the scapula, right through here. And then the muscle actually works its way laterally to the rib cage. Now, if this muscle was to shorten, the Freya segment is going to move. The scapula will either protract, or if the scapula is fixed, the thorax will actually be raised up off the mat. In either case, the proximal distal attachments of the muscles are just approximating each other. So it's important to think about this serratus anterior has this function, because if you would lift your chest off the mat real slowly, okay, up and then slowly back down. Okay. What Angela's scapula are doing, they are being protracted at the same time the thorax is actually lifting. So the muscle's really contracting at both ends. Proximal segments moving toward the distal and vice versa. Why don't you do that a couple of times? Up and back down. So up and back down. So really all I'm doing is just approximating the proximal distal attachments of the serratus anterior. And this is a real nice functional way to challenge this muscle. You can actually load the thorax by putting weight on the thorax, actually give that resistance manually, or use sandbags. Let me try that just a couple more times. Up. So the idea is get the greatest distance from the chest to the mat and get as much protraction as you can from the scapula. And if I put my finger right here, you can do a couple more of those. You can see that in maximal protraction, she really is, I'll follow her medial borders over to here. A couple more, please. That's it. Good. And relax. Good. Now, sometimes someone may have an asymmetric weakness, where they're weaker on one side than the other. And let's assume that we're really going to concentrate on Angela's right side. So if you kind of just balance your left side, as shown here, and really concentrate on just this side. So this is really a unilateral activation of the serratus anterior. And it certainly challenges all glenohumeral musculature as well. So this is a real good fundamental task to challenge the serratus anterior and all the muscles that actually give stability to the glenohumeral joint. And if you use that a couple more times, that's it. Go up against resistance. And then if you could come back and do it with both elbows down. Good, just a couple more. Now hold it up there, and then slowly lowering down is really an eccentric activation of that same muscle. And then if you were to shorten that muscle, bring it up again, and then relax. Understanding the normal scapulohumeral rhythm at the shoulder really is an important prerequisite to understanding the abnormal mechanics of a winging scapula. Now what we have here is, we have the scapula is in its regular resting position, and we have various force vectors that represent different muscles. We have, if you picture the scapula being in this position, we have the serratus anterior muscle that's pulling in this direction, which would be an upward rotator and a protractor of the scapula. This is innervated through the 6th and 7th nerve root primarily. We have the three parts of the trapezius, upper trapezius, middle trapezius, and lower trapezius, all attaching from the axial skeleton into the scapula. This muscle group is innervated primarily by a cranial nerve 11. We have a muscle force vector that represents a resultant of the glenohumeral abductors. It could be the middle or posterior deltoid, shown here. This is innervated more at the C5 and C6 level. So we have various muscles of different innervations all have to control the mechanics to bring the arm up over the head. And I'm mentioning this because with a spinal cord injury that you have weakness in the serratus anterior, the deltoid muscle becomes a prime mover. Whenever you need glenohumeral activation, the scapula tends to downward rotate and wing. Winging meaning that the medial border will flare upward. And that winging really is driven by the deltoid not being opposed by a serratus anterior. Now, if the scapula is in this unstable position, which I'm going to show you somewhat in a moment, the lower trapezius end is not as effective of a scapulothoracic depressor, so it makes it more difficult to actually raise the rear end. Now, Kurt has some weakness on this side in C6, and he's able to compensate really very well for his problems in the weakness. Let's first show the normal mechanics of upward rotation. Kurt, if I can get you to just bring your arm up over your head and relax. I'm going to help him out a little bit here, but basically the scapula is going to upward rotate and downward rotate. Upward rotate and downward rotate. Now the mechanics are the deltoid is going to be the prime mover in abducting the glenohumeral joint. The scapula is going to upward rotate by a force couple. Force couple being serratus anterior, lower trapezius, and upper trapezius. Now all these muscles rotate the scapula upward, protect the length tension relationship of the deltoid. Now with a spinal cord injury and weakness of the serratus anterior, we have a mismatch of the kinetics. Now, Kurt, if I ask you to do a sitting push-up, okay, and now come back down just a little bit, and the mechanics of the sitting push-up requires that this whole upper arm remains stable. Now, it's a glenohumeral joint, so you really have to drive your glenohumeral abductors. The elbow needs to remain extended, and the extension really is driven by more proximal musculature, and he needs this 90-degree angle at the wrist. He has this stable pistoning action of the upper extremity. By dropping the head and putting tension on thoracolumbar fascia, it tends to raise the rear end. Now, all that being said, there's an extra assistance of other muscles that occur, primarily the lower trapezius. If you actually try to do that sitting push-up and hold it right about there, notice that his scapula starts to downward rotate and wing. The medial border flares off the rib cage. And the reason for that is that the deltoid muscle now actually pulls the scapula in this direction. You can just take a rest if you want. And then come back up. The deltoid muscle becomes the prime mover of the scapula, rotating it downward when it's unopposed by a weak serratus anterior. From this downward rotated position, the lower trapezius then, which now wants to change its force direction, because when this muscle shortens, it's actually going to raise the rear end. And then relax a second. Good. Come back down. Got another one. The head-hip relationship is essential here. And forward and relax. So once you master the ability of raising your rear end up like this, the next idea is to start to challenge him side to side. And again, he will capitalize on the head-hips relationship. Not only is he going to lower his head, but by rotating his head to his right, he's going to help wind up a lot of the tissue in his lower back to help translate his body to his left. All right. So why don't we try it? Let's just work on just taking your rear end and just move it about 6 inches to your left. Show me that head-hip relationship here. Good. And then why don't you bring your legs next? And the whole aspect of manipulating your legs to follow you after you've moved is very, very important. That requires that he's stable on his left side. Okay. Why don't you just slow down this a little bit here? This whole aspect of moving your legs requires that he can bear weight on this left upper extremity. And fortunately, he has triceps that helps lock the elbow. And then be free enough and be stable enough that he can then manipulate his legs to his other extremity, using primarily his wrist extensors and elbow flexors. And again, the confidence it takes is all part of this, that he's stable in this position. So I think what I'll do now, Frank, is I'll move your legs for you so we can kind of speed things up here. What we'll do is, which is very helpful, is for him to actually do these series of sitting push-ups around the whole perimeter of this mat. And this is very good to actually build endurance as well. Do a short one right here. Okay, and I'll take your legs from here.